Hi, I'm Dr. Travis McCoy. I'm a reproductive endocrinologist with Piedmont Reproductive Endocrinology Group. And one of my specialty areas is the male infertility. Many of you know we start with the evaluation of the males with a semen analysis. But what do we do after that point? Well, one of the first things we look at, I want to show you, is what's called the total motile sperm count. So the main number we look at is the total count of moving sperm. This is the volume times the concentration times the percent moving gives us this total motile count. A normal level is above 50 million, and that should be enough just to allow normal intercourse, though average for fertile men will be about 175 million. In the low range, in the 15 to 30 million range, they may benefit from inseminations or IUIs to concentrate up the sperm. But in very low categories below 10 million, we really have to resort to IVF just from the male factor. So what are some of these causes? Well, in order of frequency, the number one issue we see is just an inherent low testicle function, where it's always been that way and it always will be that way. In some cases, there can be low brain signaling to the testicles, and this may be correctable. In lesser common issues, there can be what's called varicoceles, which is a physical issue around the testicles, but this is a much less common issue. So what do we do to evaluate the guys? Well, it's pretty easy. We initially start with just some blood work to look at the brain signaling to the testicles and a physical exam, which shows us those varicoceles. So the brain sends signals to the testicles, primarily the hormone FSH, and the testicle sends testosterone back. And they talk to each other. It works like a cruise control in a car. So by looking at the blood work, it will really tell me if this is an underlying issue that's always been there, or if this by chance may be correctable. If it's an underlying issue, we can't correct that and we have to work around it. And that's based on the numbers that they have on average. If there is a low brain signaling issue, we can correct that by using medications. And the idea with that is to try to get into a higher category, which will always be simpler and easier and cheaper. And so many guys can be corrected, many guys cannot be corrected. But our goal is to try to fix it if we can, but if not, we have options to work around it as long as there are some sperm there. I hope that gives some information. Thanks.